Welcome friends to my YouTube channel on health issues. Today I will discuss you one story, and that is a story which tell you exactly what is the severity and what are the the how the AMR antimicrobial has become a crisis. As you all know that in my earlier videos as well, and several news all across the globe, that antimicrobial resistance, that in short we call AMR, has become a global concern. It's a crisis, right? For healthcare workers, for patients, for elderly patients, especially and neonates, because to date, no antibiotic is left to treat patients if the infection caused by multi-drug resistant bacteria. The last resort of medicine, the last resort of antibiotic, that is called colistin after carbapenem, has lost its efficacy because of the fact that the resistance developed in the bacteria, different bacteria, against the colistins and polymyxins as well, because of the emergence of several mutations, several genes, marker transfer, and so many other reasons behind that. So in that scenario, we should be very careful about antibiotics use, and we should not misuse and overuse of these antibiotics. So as far as the story is concerned, I'll just talk about my own research, and the story that we are telling you is a very pathetic story, where there's one patient. He's a poor farmer who visited the JNMC hospital to complain that he had a fever. I mean, I think it's a couple of years back. We talk about 2-3 years back, and the fever, high grade fever, and there's a burning sensation and urination during urination. Then he talked about doctors. Asked so many questions about this patient that regarding the burning sensation, fever, and other problems. Then he got admitted because of some severe condition, and he was given a first line of treatment of antibiotics. Then the next generation of antibiotics was given, and after 2 weeks he was not cured. Still fevers continuously persisting for high grade fevers, and urine infection was still there. Then the third line of drug, and that is the last resort of drug we call carbapenems, imipenem and meropenem, probably one of the drugs, one of the antibiotics of the carbapenem groups, imipenem or meropenem, was started, and then waited again for a week time, then extended for a few more days. At least after 10 days, again patient was not cured. That's a very difficult situation for healthcare workers, for especially physician and for other healthcare workers, and the pay for patients also. And then what happened? He was diagnosed as the kidney infection. Then kidney infection, after having known the kidney infection, again patient was put on the prolonged antibiotics, and still after a few days, at least 3 to 4 weeks has passed through this whole process during he admitted, he could not recover, and ultimately he failed the kidneys were failed, and the patient was expired. By the time the patient was in critical condition, the physicians collect the samples again, and they send the sample to us, blood samples and urine samples. And what we found during the identifying the bacteria and the resistance pattern, and we found the Klebsiella pneumonia was there. And this Klebsiella pneumonia, it's E. coli was there. It's a uropathogenic E. coli, and this E. coli having the resistance against the imipenem, carbapenem. And when we molecular level, when we test these genes responsible for the resistance, was found to be New Delhi metallobeta-lactamase, in short we call NDM1. And this NDM1 was not there. It's NDM1 variant was there, which is more severe than NDM1. It's NDM6 variants. So he was diagnosed to have NDM6 superbug during his treatment, and so he could not be treated, and he expired. So I think he took like 4 weeks, 3 to 4 weeks to expire after he got admitted because of the difficulty in treatment, and no drug was left to treat this poor fellow. And so this is a story which I am telling you just to show you the situation, what is going on around. And many people are dying because of the unavailability of the drug, unavailability of the correct right antibiotics to treat that particular infections having caused by certain bacteria, having the resistance in that. So therefore, please, the message here is that don't allow bacteria to cause you infection. So you be clean, follow the wash, as the WHO declared the word wash. Wash means water, clean water, hygiene, and sanitation and hygiene. So you be very careful about the hygiene and sanitation all around you. Eat clean food, eat clean water, drink clean water, and be careful about the infection. So if you avoid infection, you will avoid the resistance problem, and then you will avoid the having the ineffective drugs to be used for your treatment. And this is how you need not to get any kind of antibiotics, any kind of a drug to be treated, and you'll be happy, in your. So the last message here in this video is that whenever you found that any patient or any poor patient or any patients having such kind of infection, so first he or she should be tested at a very early stage. So first diagnosis and testing, the real resistant marker in that should be very, very important. And then accordingly, the empirical treatment can be started. If that patient could have started earlier, the cholesterol, at least he could have saved, although cholesterol has its own side effect, but at least his life can be saved. So therefore, be careful about that, and be careful about the patient's conditions, and early diagnosis, early detection of the resistant marker is a very, very important before the treatment is started. I think this is an important video to share with others, and also follow it so that you can save your life and life of your friends, your fellow colleagues, and your family member. Thank you very much.